Hey, Dr. Praveen Ramachandra. We're diving deep today into some really fascinating research, especially for you and all our endocrinologist listeners.
Oh, it's a hot topic.
It really is. Imagine a once-a-month injection that could significantly lower triglycerides and, potentially even reduce cardiovascular risk. That's the promise of olezarsen.
It's certainly got everyone talking.
It really does. This brand new medication is making some serious waves in the endocrinology world.
And for good reason. The research is promising.
It is. We're going to unpack a recent study on olezarsen. It's hot off the press from the New England Journal of Medicine, and we'll explore why everyone's buzzing about it.
Sounds good.
We'll break down the science behind olezarsen. We'll see how it performed in the Bridge TMI 73A trial, and then we'll discuss what it all means for treating hypertriglyceridemia.
Yeah, it's a really important deep dive, especially when you think about the challenges we face in effectively managing those triglyceride levels in patients.
You're absolutely right. And that's where this research gets so interesting because it addresses a real need. I mean, we know that high triglycerides are linked to heart issues and pancreatitis.
Right.
And sometimes our current treatments just don't cut it.
They fall short.
They really do. So researchers are on the hunt for more effective options, and olezarsen seems like a real contender.
It does, and understanding how it works is key.
Absolutely.
So olezarsen is an antisense oligonucleotide.
Okay.
It might sound complicated, but essentially it targets and silences the messenger RNA responsible for producing apolipoprotein C3-APOC3 for short.
So it's like intercepting a message before it can even be delivered.
Precisely.
But why is APOC3 so important in all of this?
Well, APOC3 is a major player in raising those triglyceride levels, and there's even a genetic link between APOC3 and an increased risk of cardiovascular disease.
Really?
So by targeting APOC3, olezarsen goes right to the root of the problem.
That's a pretty smart approach.
It is.
So tell me more about this Bridge TMI 73A trial.
Yeah.
What kind of study are we talking about, and who were the participants?
Okay, so this was a phase 2b study, meaning it was designed to evaluate both the effectiveness and the safety of olezarsen in a larger group of patients. It was randomized and placebo-controlled, which is the gold standard.
Of course.
And importantly, it focused on two specific groups of patients, those with moderate hypertriglyceridemia and elevated cardiovascular risk, and then those with severe hypertriglyceridemia.
So kind of like two sides of the same coin.
Exactly. And researchers wanted to see how olezarsen worked in these particular patient populations, and the results were impressive.
Okay, give me the highlights. What did they find?
Well, olezarsen significantly reduced triglyceride levels compared to the placebo, and we're not talking small reductions here.
Yeah.
Over 85% of patients with moderate hypertriglyceridemia at baseline achieved normal triglyceride levels less than 150 milli-GDL after just 6 months.
Wow, those are some seriously impressive numbers.
They are.
But did it work equally well for both doses?
That's a great question. The trial tested two different doses of olezarsen, 50 milligrams and 80 milligrams, both given as monthly injections.
Okay.
Both doses were effective, but the 80 milligram dose did show slightly better results.
Makes sense. More bang for your buck, so to speak.
In a way. But here's what really caught my eye. Olezarsen didn't just lower triglycerides.
Oh.
It also had a positive impact on other markers of cardiovascular risk.
Now, that's a game changer.
It is.
It seems like olezarsen is offering a two-pronged approach, tackling high triglycerides and mitigating cardiovascular risk.
Precisely. And that's what sets it apart from some other triglyceride-lowering medications that haven't shown those same benefits for cardiovascular risk reduction.
Right. This is incredibly promising, but of course, no new medication comes without potential side effects. What did the trial reveal about the safety of olezarsen?
Well, that's a critical point, and the researchers were thorough in their assessment. They did observe some increases in liver enzymes in some patients taking olezarsen, but clinically meaningful increases were actually quite infrequent. And importantly, there were no cases of severe thrombocytopenia.
Okay, so remind me, what is thrombocytopenia again?
It's a condition involving a low platelet count, which had been a concern with a similar drug in the past.
Right. So it sounds like the safety profile so far is pretty reassuring, but obviously more research is always needed.
Absolutely. Longer-term studies are crucial, and fortunately, there are ongoing phase 3 trials that will give us a much more comprehensive picture.
That's good to hear. Well, this has already been a fascinating deep dive. We've learned about the science behind olezarsen, explored its impressive results in clinical trials, and even touched on its potential implications for the future of triglyceride management.
And we've only just scratched the surface.
I know. In the next part of our deep dive, we'll delve even deeper into the Bridge TMI 73A trial. We'll examine the study design and really unpack those nuanced findings, and then we'll shift gears and focus on how this might impact your practice and how other endocrinologists might incorporate this new therapy into their treatment approaches.
Looking forward to it.
Me too. We'll be back right after this. Welcome back. Let's get back to olezarsen and take a closer look at that Bridge TMI 73A trial. I'm really curious to hear more about the specifics of this study.
Yeah, so this was a phase 2b study, remember?
Right.
It was designed to evaluate both the effectiveness and safety of olezarsen, and it involved 154 patients across 24 different sites in North America.
Okay, so a decent number of participants spread across various locations. That helps ensure the results are more generalizable, I guess. But what about the specifics of the treatment? What did the patients actually receive?
So the patients were randomly assigned to receive one of three options, either a 50 milligram dose of olezarsen, an 80 milligram dose of olezarsen, or a placebo. All of these were administered through a monthly subcutaneous injection.
So pretty convenient for patients then.
Exactly. Ease of administration is always a plus. But yeah, I'm sure the researchers didn't just choose those doses randomly.
Right. Was there a reason behind testing both 50 milligrams and 80 milligrams?
Oh, absolutely. They wanted to explore that dose-response relationship with olezarsen.
Okay. In other words, did higher doses lead to greater reductions in triglyceride levels, and were there any differences in terms of safety?
Gotcha. It's all about finding that sweet spot between effectiveness and safety, right? But let's get to the heart of it. What was the primary outcome they were looking at, and what did they find?
So the primary outcome of this study was the percent change in triglyceride levels from baseline to 6 months. And as we mentioned earlier, the results were pretty remarkable. Olezarsen at both doses significantly outperformed the placebo in lowering triglycerides.
I remember you mentioned those impressive reductions. Can you remind me what the actual numbers were?
Sure. The 50 milligram dose of olezarsen reduced triglyceride levels by an average of 49.3 percentage points compared to the placebo.
Okay.
And the 80 milligram dose achieved an even greater reduction, averaging 53.1 percentage points.
Wow, those are substantial decreases. But were these results consistent across different types of patients? You know, that's a great question, and the answer is yes. The researchers found that these reductions were consistent across various subgroups of patients, regardless of age, sex, or the severity of their hypertriglyceridemia at baseline. Even patients with diabetes or those already taking fibrates saw significant triglyceride-lowering effects.
That's really encouraging. It sounds like olezarsen could be a viable treatment option for a wide range of patients struggling with high triglycerides. But now let's switch gears and talk a bit more about the safety data. I know there were some concerns about liver enzyme elevations. Can you elaborate on what they found there?
Sure. So while there were some increases in liver enzymes observed in patients taking olezarsen, it's important to emphasize that clinically meaningful increases were infrequent. The majority of these elevations were mild and didn't require any specific intervention.
Okay, that's good to hear. It sounds like the benefits might outweigh the risks in many cases, but obviously continued monitoring is essential.
Absolutely. Longer-term studies are needed to fully evaluate the long-term safety profile of olezarsen, but the initial findings, particularly the absence of severe thrombocytopenia,
Right.
which was a concern with a similar drug, remember, definitely reassuring.
Right. That's a significant point of differentiation.
Yeah.
But beyond just triglyceride reduction, the Bridge TMI 73A trial also looked at other important lipid measures, didn't it? What did they find in those areas?
They did, and their results were quite promising. Notably, olezarsen significantly reduced levels of apolipoprotein B, a key marker of atherogenic risk. Apolipoprotein B is a measure of the total number of atherogenic particles in the bloodstream, including LDL cholesterol and other potentially harmful lipoproteins. So the fact that olezarsen lowers apolipoprotein B suggests that it could have beneficial effects beyond just reducing triglycerides, potentially reducing the risk of cardiovascular events.
That's really exciting.
Yeah.
So it's not just about addressing the immediate issue of high triglycerides, but also mitigating long-term cardiovascular risk as well.
Exactly, and the positive findings didn't stop there. Olezarsen also significantly reduced non-HDL cholesterol, another important indicator of cardiovascular risk. Non-HDL cholesterol includes all the cholesterol carried by potentially harmful lipoproteins, excluding the good HDL cholesterol.
Right.
So reducing non-HDL cholesterol provides further evidence that olezarsen could play a significant role in lowering the risk of cardiovascular events.
This all points to olezarsen being more than just a triglyceride-lowering medication. It could be a powerful tool for improving overall cardiovascular health.
That's the hope. These findings are incredibly encouraging, and they suggest that olezarsen might have a much broader impact on cardiovascular health than some other triglyceride-lowering therapies.
But it's important to remember that further research is still needed
Oh, absolutely.
to definitively confirm these potential benefits and understand the long-term effects.
Larger, longer-term trials are essential to establish the full scope of olezarsen's cardiovascular effects. Fortunately, those trials are already underway.
That's great news. So as we move into the final part of our deep dive, let's switch gears and think about the bigger picture. How might these findings impact your approach to treating patients with hypertriglyceridemia? What practical considerations should endocrinologists keep in mind as this new therapy potentially becomes available?
That's where the rubber meets the road, isn't it? There's a lot to consider. But before we dive into that, let's take a quick break.
We're back and ready to wrap up our deep dive into olezarsen. So let's talk about what all of this means for you and your fellow endocrinologists on the front lines.
Yeah, it's definitely created a buzz.
For sure. But new therapies always come with a learning curve. How do you see olezarsen potentially changing the way you approach treating patients with hypertriglyceridemia?
Well, it's exciting because it gives us a powerful new tool. We're talking about a medication that can significantly lower triglycerides,
Yeah.
which has been a real struggle for some patients.
Especially those with severe hypertriglyceridemia, where the current options haven't been as effective.
Exactly. And what's particularly exciting is that olezarsen seems to go beyond just lowering triglycerides. It tackles those atherogenic particles as well, reducing apolipoprotein B and non-HDL cholesterol.
So it's not just about managing symptoms, it's about potentially preventing serious health problems down the road.
Precisely. It's about improving both the short-term and long-term health outcomes for our patients. But, it's important to remember that we're still in the early stages. Long-term data is crucial, and those ongoing phase 3 trials will give us a much clearer picture of olezarsen's long-term efficacy and safety.
And how it compares to other emerging therapies that target similar pathways.
Right. There's a lot of innovation happening in this field. It's an exciting time to be an endocrinologist, but it also means we need to stay informed and carefully evaluate the data as it becomes available.
So for endocrinologists who are listening, what are some practical things they should be thinking about if olezarsen does become widely available?
Patient selection will be key. The Bridge TMI 73A trial focused on patients with moderate hypertriglyceridemia and elevated cardiovascular risk, or those with severe hypertriglyceridemia. So those are likely the patients who would benefit most from olezarsen, at least initially.
Makes sense. Start with the patients who most closely match the study participants and then go from there.
Exactly. But of course, future research may expand its potential applications. Another important consideration is monitoring. As with any new medication, we need to be vigilant about potential side effects, even if they were infrequent in the trials.
Especially those liver enzyme elevations we discussed earlier.
Right. Regular monitoring of liver function will be essential, and as we get more long-term data, we'll have a better understanding of the full safety profile.
And of course, cost and access will always be factors in real-world clinical practice.
Unfortunately, that's the reality of healthcare. But if olezarsen proves to be as effective and safe as the early data suggest, I'm hopeful that it will become accessible to those who need it most.
It's a promising new development in the fight against hypertriglyceridemia and cardiovascular disease. And it's all thanks to the dedicated researchers who conducted the Bridge TMI 73A trial.
Absolutely. Their work is paving the way for better treatments and healthier lives.
Well said, Dr. Praveen Ramachandra. Thank you so much for joining us for this deep dive and for sharing your expertise with our listeners.
It's been my pleasure. Always great to be here.
And to all of our listeners, we hope you found this exploration of olezarsen informative and insightful. While long-term data is still needed, olezarsen raises a fascinating question. Could targeting APOC3 become the cornerstone of future cardiovascular risk reduction strategies? It's something to ponder as we continue to navigate this ever-evolving world of metabolic disease management. Thanks for joining us.